When I was a child, I think many little girls may want to be doctors, at least I wanted to be. Um, Went to university, decided that medicine was the thing I wanted to do, not necessarily oncology. And pretty early on, found some women who I thought were role models for me. My microbiology professor was a mother of three, married to a obstetrician gynecologist, and so she was somebody who I looked to give me inspiration and guide you as you went through. In my medical school, women were just close to 50%, and that was something that was noted and commented upon, that the proportion of women in medical schools was increasing. But as you went further along, it was clear that you were on the forefront. So sometimes there weren't women separate changing rooms in the OR. The whole receptiveness to being female was not always there. And so you had to learn that it was a man's world. You were there, but there were things weren't necessarily laid out for you the way they would have been for your male counterparts. So I think women have to help define their role, and I think you as a female physician also have to decide where you're comfortable. So when I was in my training, there was one female urologist at MD Anderson, one. Now female urologists are not uncommon. That's, I think, a good thing. From my standpoint, oncology was also relatively male-dominated when I started. I think there are a lot more female oncologists now, and there are certain areas such as breast oncology and GYN oncology where, in fact, men are in the minority as women seek out people who they think more represent who they want to take care of them. And there's nothing wrong with that on either side. I think if we remember that the patient is the most important person in the room, then you have to be able to meet their needs. And I have female patients who say, I really want a female breast surgeon to do my breast cancer surgery. And that's their right to request that kind of service if that's what they need. And I don't think that's exclusionary to men. I think it's just the way the society has evolved to meet the needs of different people with different needs. I think there are always stigmas because we're all different. I think specifically for women, one is that we're emotional, which is a good thing and a bad thing. The other is that we're going to leave and go and have families and therefore not make good on all of the resources that were poured into us. But I think being emotional is not a drawback in medicine. In fact, I think it's a plus. And there are patients I've cried with. That's okay, because sometimes we talk about really sad things. And so I don't think that's a drawback at all. I think the ability to feel some of what my patient's family is feeling and what they're feeling is an asset. With regard to the fact that we do give birth, it's all about planning, right? I think you, with careful planning, can do it. You have to be thoughtful about what you do, and you have to make choices in life. But I have 3 daughters, and they're all between 4 and 5 years apart because you can only do one at a time when you're really busy. But they are perhaps the most important thing I've ever done. And that includes work. They're the most important thing I've ever done. So I would celebrate any woman who wants to be a physician, have a family, do it all. There's no such thing, but there's nothing wrong with trying. And planning and being disciplined, you get there.